Reusing medical supplies and operating without anesthetics. That's the reality in much of Gaza, where the injured are faced with a health system that collapsed a long time ago. Teams of international doctors who have been able to enter the Strip are shocked by the number of children they're operating on. And that includes Dr. Victoria Rose. She was the only plastic surgeon at the largest facility in southern Gaza, Nasser Hospital, and saw a steady stream of children with blast wounds to the face and limbs. Well, she's just returned to the UK from Gaza, and she's joining us on the Al Jazeera News Hour. Dr. Victoria Rose, thanks very much for your time with us. As we're saying, you've just returned. You were working at Nasser Hospital in Khan Yunis. Can you speak to what you saw there and what shocked you the most?
I think what shocked me the most this time was the number of children that I saw and in fact operated on. When I'd been at the European Gaza Hospital in March, it was a lot of children then. But now in August, I would say that 80% of everyone I treated was under the age of 16.
What sorts of injuries would you see, and what sort of operations would you be carrying out?
All of the injuries were explosive related and burns. There was no real other injury apart from explosion or a burn. So the sorts of things that I was mainly treating were sort of third-degree burns, 30–40%. I saw a lot of lower limb trauma, children losing legs, losing arms. We had a couple of upper arm amputees, a lot of facial injuries. I had a 7-year-old that had most of his nose blown off and a big hole in his lip. A girl that had lost quite a lot of her skin down to the bone on her forehead. So what tended to happen is in the explosions, the children would either get burnt or shrapnel or part of the building that had crumbled would be weaponized and held at them and then inflict a sort of soft tissue wound with or without an underlying bony injury.
Have you ever seen anything like this?
No, never.
How are the children coping and their families?
Various ways. I mean, the whole spectrum. We had a few children that refused to speak to us or engage with us or really with any of their family. And then some children who sort of, managed to cope with their injuries and sort of were really conducive to treatment and seemed to be able to get by. But it was a real mixed bag. A lot of the children are so young, I don't think they understand the significance of some of the injuries that they've sustained.
There have been several attacks near hospitals throughout this war, or even on a field hospital in central Gaza. That took place on July the 27th. Many children there among the dead. I mean, the doctors and the nurses and all your colleagues on the ground will have to be making some tough decisions as to who to try to save, considering the lack of space, the lack of anesthetics, the lack of supplies, and the list goes on and on. I mean, how difficult were these decisions to make?
I think we were making sort of decisions that we wouldn't make if the children were in the UK. There's a lot of situations where we amputated because, we didn't have the ability to do the reconstruction, and we knew that if we didn't do the amputation, the risk of infection and then death from sepsis was a possibility. So things like that were fairly uncomfortable to do. There was a real sort of paucity of specialties. So we didn't have an ENT surgeon or a maxillofacial surgeon. I was the only plastic surgeon in Gaza for the month. There hadn't been a plastic surgeon in Gaza or at the Nasser Hospital since May when I arrived. So there was quite a number of people who had sort of been waiting for somebody that could do plastic surgery. And obviously, if you've waited a couple of months, the wounds are heavily infected. A lot of the patients are malnourished. So a lot of the procedures that I was attempted to do would either get infected or have to be delayed until the wounds were cleaner.
Okay, we'll have to leave it there. Dr. Victoria Rose, we thank you so much for speaking to us from the UK.
Thank you very much.